If you're facing a mental health crisis and would like to consult a mental health professional, would you call on a psychiatrist or a psychologist? Hi, I'm Dr. Ooha. I'm a psychiatrist and I'm here to answer all your questions. Let me start with a brief overview. So, a psychiatrist is a medical doctor who have done their MBBS and then they have done their MD or DPM in psychiatry. So, they are licensed to treat you with medicines and also with all forms of therapy. A psychologist, on the other hand, has done their bachelor's in psychology, followed by their master's in psychology, and in some cases, an MPhil in psychology, which will come to that. So, they are also licensed to provide you with all forms of therapy, but not licensed to prescribe medicines. In practice, we work together. So, if a patient comes to me with any stress related issue or even mild forms of depression or anxiety, I actually recommend them to seek out therapy first. But in case a patient comes to me in such a state of mental fatigue that they're not in any place to respond to therapy or respond to any counseling measures, then I would say that yes, let's start off with medication and seek out therapy down the line. Of course, in the case of severe mental illnesses like schizophrenia, delusional disorder, bipolar disorder, or OCD, medicines are the primary route of management and they've been life changing for a number of patients. Okay, so coming back to the psychologist versus the psychiatrist debate, let me tell you how I do it. When a patient comes to me seeking help, I first do my initial comprehensive assessment. I rule out any medical causes of mental illnesses like thyroid issues or anemia or any kidney disease or any other neurological problem, and then I formulate a diagnosis and I formulate a plan of management, and then I rope in a psychologist for therapy. This I found to be the best way to utilize both our specialities, because a psychologist's insight into the patient's personality, into their interpersonal dynamics with the people around them, into the way they generally associate and process conflict, I found all of this to be extremely valuable in formulating a treatment plan that is specifically tailored and meets all the requirements that the patient has. Many a times I also take up therapy for my patients, but of course this is based on their comfort level with me and also their willingness to engage in therapy with me versus a completely new professional. Now, among psychologists also, we have counseling psychologists and clinical psychologists. So counseling psychologists have done their bachelor's followed by their master's, whereas clinical psychologists have taken this a step ahead by doing an extra course called MPhil for 2 more years. This is called MPhil Clinical Psychology, and during this course they are trained in close contact with psychiatrists and also psychiatric patients. So this gives them a very unique insight into the needs of patients with severe mental illnesses and all the forms of therapy that such patients might need. So when a patient comes to me and they are diagnosed with something that is very clinically based, or maybe they need screening for a clinical disease like ADHD screening, or maybe the Rorschach blot test that we do for psychosis, or even a personality test like an MMPI personality inventory for a personality disorder. For all of these needs, I generally prefer to refer my patients to a clinical psychologist. But if the patient is coming to me for day-to-day issues or issues that any of us can face, it's a difficulty dealing with a life event or a time in their life that's extremely tumultuous, then I would definitely recommend a counseling psychologist who can help you work on your coping mechanisms and give you gentle guidance as to how to deal with the problems in your life right now, but not in a structured manner, but more in a tailored manner. Now, with all of this background, I'll come back to the first question. When you're facing a mental health crisis, would you call on a psychologist or a psychiatrist? So this is my recommendation. Visit a psychiatrist like me. I will take a thorough history. I will do a thorough assessment. I will rule out any medical issues that you might be having like hypothyroidism, anemia, epilepsy, seizures, any neurological issue that might be contributing to or masking the issue at hand. Then I'll formulate a diagnosis and also formulate a comprehensive management plan. Now this management plan will have multiple options in it, and all of these options will be discussed with you, and we will create a plan of treatment together. Now after this plan of treatment has been created, whether you want to follow through with it, whether you want to make any changes, the choice is always yours. You make the choice about your life. But just remember, it's always okay to seek help. And that's all from me today. Bye.